stuck at the light, and I said, ha.
Good, Leanne.
All right. Good afternoon, everyone. I'd like to call our March 18th, 2026 Board of Health meeting to order. I'll first ask for our approval of our agenda today. All those in favor?
Aye.
All right. We'll move on to our approval of the minutes of our meeting of February 18th of 2026.
There are no additions or corrections. I move to be accepted as submitted.
A second.
All those in favor?
Aye.
Okay, we'll move on to our public presentation on the county septic inspections. Who is going to be your spokesperson? If you could just introduce yourself and state which group, I guess that's the best place to call it, that you're associated with, so we can have that for the record, please.
Okay, my name is Sue McCauley, and I'm a director at Citizens to Protect the Irish Hills. And the reason I'm here is, we'll get into the septic program, but one of our focuses at Citizens to Protect the Irish Hills is to improve our water quality or maintain it. And we've teamed with the Western Lake Erie Basin Advisory Group and the Lake Erie Volunteer Service Network. And these, the first one, the Western Lake Erie Basin Advisory Group is started by the state. It's done at U of M. And so they're very concerned about what's going into our waters because of Lake Erie and the algae blooms that they get down there. And then the Lake Erie Volunteer Science Network is another one going from Ontario to Southeast Michigan, over to Cleveland, all the way up to Buffalo. And so they're doing a lot of testing over there. So those are the part of the groups I'm with. So because this is such an important piece to us, and septics are one of them. Obviously, there's other things that are going into our water, but septics are a big deal. I teamed with Bill Kittredge and Tim Husbands, who are the experts in this, with information on this. So we can go ahead and switch, if we could, please. So our headlines in papers are kind of telling the story. This may not be Lenawee County, but it is a problem throughout the state, and it is here too. We just don't have the headlines. Could we flip again, please? Thank you. So in 2025, Eagle estimates we have 1.3 million septics in Michigan, 210 millions of gallons of sewer produced every day from a septic, and at least 20 of it is from failed, allowing 40 million gallons to go into our waterways, basically, or into our environment. 25% of the septics that have been inspected by health officials were faulty. So it's kind of a scary number. MSU did some testing a while back, and they tested 64 streams and found human DNA in all 64 streams. So Lenawee County has roughly 21,000 septic systems, and over 80% of these 20 years or older or lacking a permit, so even older. I mean, we're talking maybe 50 years old cottage on a small lake, possibly. If you think about that, that's about 40,000 septics that are failing here in the county, if you take those numbers from Eagle's estimates. And the average person does not know how to maintain a septic properly. They don't know you need to pump it every 5 years. They don't need you have to have it inspected. They just keep using it. So if you could please flip the slide. The first bill that the state introduced was 2001, 2002 legislation. Governor Granholm tried in 2004 by creating the Water Task Force because we had no plan. And, you know, if you compare us to Wisconsin or Minnesota, they have plans. They have state codes. You know, you drive around Wisconsin, they have the engineered septics by the lakes. You don't see that here. Numerous other bills have tried between 2001 and 25, even as recent as 2 years ago. And that sat on the shelf, didn't leave the House. Senate Bill 771 was introduced on the 28th of this month, of January. But if it passes, it allows 13 years to implement before the first inspection gets done. That's a long time. That's 2039. You know, some of us aren't even going to be here. And this one does do a 10-year routine inspection. High-risk ones that are 20 years or older would be 500 feet of water, they would be inspected. And there's a technical advisory that will guide Eagle to set the standards and protocols. So, thank you. Michigan is one of the only states in the county without a statewide septic code. And here we're in the Great Lakes, we hold 84% of the fresh water. So it's kind of crazy that we don't have a state one. So Lenawee County's communities are taking water from River Raisin. And that's running right through our whole county. And Adrian and Blissfield pull water out of that reservoir. So 11 counties already have adopted a septic inspection, as you can see on the map. And right around us, if you look, we've got Washtenaw, Wayne, and Macomb. So it would be really nice to get Lenawee. I have every intention of going to Jackson because, you know, I'm doing the Irish Hills thing and presenting this at Jackson. So if we can't get the state to do it, we're really asking the counties to look at this seriously. Could you switch? Yes, thank you. So we did some local testing. This is where Phil and Tim come in. They were testing 15 sites at the Wolf Creek watershed they started in 22, so for a while. 8 of those sites tested showed DNA and predominantly human DNA. And then Eagle did some testing in that same watershed, and those are the results where it says you can't consume fish in those things. You can't touch the water. It's pretty scary because of the E. coli and the phosphorus. You know, obviously I'm not here about phosphorus, but I am here about the E. coli. If you could flip, please. This is their testing results, and I want to just bring you to the line that's 1,000, so it's the solid red line. Those are when you don't touch the water because it's not good for humans. Let's see how many readings they had above that. Again, it's pretty scary. Phil, do you have anything to add?
So that is showing several different test sites and the dates on each site. The top line is the don't touch line, we call it. The dashed line you see there is don't swim in the water. So these are all drains around Loch Erin in the Wolf Creek area in 2022, and the bottom one I think is 2022 and 2023. So that's across 2 years. And you can see several places you shouldn't be even touching that water in that drain.
Okay, we can go on.
Sure. So this is one of the drain inlets to Loch Erin. And on the far left is 2021 readings, then 2022. There's a house that is on top of the drain. It goes underground for a while. There is a house right on top of that. That house went up for sale in 2024. So you can see the readings start to drop down. Again, that's E. coli in the water. And then 2020, 5, you could see we're showing a septic tank was replaced on that property. The E. coli readings in the drain roughly a half mile away drop way down. So just one house having an upgraded septic system or replaced septic system makes a significant difference in the E. coli levels at that location.
So this is one small example, one little corner. Like, can you imagine how much else? So we're here to ask the health department to consider implementing a statewide septic inspection code. Our preference is a 5-year inspection program, but another one is a point of sale inspection. Some of the other counties that I showed you are doing the point of sale, although there is one that has implemented the 5-year inspection program. And even if the state does pass that bill, I don't think we can wait those 13 years. I mean, that's a long time. And we do have several volunteers here that would help us write help you write the document, drafting a document, because we do have somebody from River Raisin Watershed. She's here with us. She would be more than happy to assist us, along with Phil, myself, and Tim. So if we go to the next slide, I'll do a comparison of the two. So with the sale transfer program, this would only be done when the title changes. So, and I'm not just saying sold, it would be a title transfer also. We sold 1,787 homes last year. So it's not getting to our 4,000 that we could be failing right now. The benefit, the cost replacements can be negotiated by buyer and seller. We are opposed by the realtors, but it is easier to implement. An interval program, we're recommending 3 to 5. 5 would be great. The benefits address all properties, and it is supported by the environmental community. So, and everybody's worried about the cost. I live in Sand Lake. I have a sewer system. I pay a quarterly payment of $150 or $600 a year. That comes out to $3,000 every 5 years. I'm paying for my sewer. Everybody who has a sewer pays some way, some form. And then if your pipe gets corroded on, if you're in an older house and your pipe going to the main trunk of a sewer goes bad, what happens? If you don't fix it, your house is going to get condemned. So, but if you have a septic, it can just keep going. And it's not quite right in that sense. I know septics are costly to replace, repair, but the state does have a low interest program that people can apply for, so that they can get it done. Any questions?
Commissioner Collins?
You stated in, I think the last slide, that sold 1,787 homes in 25.
Yeah.
Are all those in areas of septic?
No, I couldn't get that information, unfortunately. That's a total,
Yeah, those are both done.
that's total homes. Yeah, it doesn't, we don't keep that data. And I would like to thank Ed Scheffler for joining us. He's the commissioner of the Drain Commission. And Joe Bellino, who's our state senator, are here in our support also. Thank you, gentlemen. Other questions?
I guess my question is, if we push for this to be implemented in Lenawee County, is the health department going to be responsible for a lot of the inspections? How does that work?
Well, I think you would approve vendors that were qualified to do it, and they would do it, and the homeowner would pay the vendor directly. Yeah, it would be a process of approving them, though.
Okay. And has anyone ever implemented both of these that you have done at the time of sale and then have an interval program as well?
I'm not sure I know the answer.
Okay. Right, so okay.
Thank you very much for your time today, and I hope you will consider this. We do feel it's a very important issue.
Thank you for presenting.
Yep, thank you.
Thank you very much.
All right, we'll move on to our report section. First is the review of the accounts payable report. I'll look for a motion to approve.
I move we approve, but. What's the word approve? Place them on file. We accept.
Accept.
Sorry, trying to get the right word. I move that we accept the accounts payable.
I second.
All right, we have support. Are there any questions? I have none this month.
Wow.
How about that?
Good.
I understood it all. All right. All those in favor of approving the accounts payable report signify by saying aye.
Aye.
All right, we'll move on to our health officer's report.
Good afternoon, everyone. A couple outreach events that we will be at in April is the health check at St. Mary's Activity Center from 8 to 12. And then also the senior resource fair at the Adrian Senior Center on April 23rd from 9 to 12 as well. Just some respiratory illness updates in the county. Influenza, COVID, and RSV are considered low transmission levels. Influenza is tracking back up after it was on the decline, and RSV has not seen an increase. I ran some reports for what the schools are seeing, and they're seeing some fever, gastrointestinal, and influenza, and just overall general sicknesses. As of Monday, when I read the reports, adults that are seeking acute healthcare for respiratory illnesses has been up overall. 79% of those individuals are adults. And 49% of those adults are 50 and older. So definitely the 50 and older are getting the illness a lot more than the others. RSV overall is less than 1% of those seeking healthcare. And 57% of the RSV cases are adults. So that is something that's not quite usual. Gastrointestinal illnesses they're increasing, but at the overall tracking, they're decreasing. Avian influenza, there has been 2 more detections in commercial flocks in Kent County. That equaled over 78,000 birds that were impacted. There was 2 recent confirmed measles cases in Washtenaw. That is the first 2 cases in 2026. If there's any questions on that information, I will be happy to answer.
All right, thank you, Monica. We'll move on to existing business.
None that I know of.
All right, and new business.
We do not have any.
All right, we'll move on to our program reports. We'll start out with personnel health.
Good afternoon. Clinics are steady, as they have been over this winter. Clinic, cabinets will be installed on Monday and Tuesday. And in April 13th, our front window with additional protection for staff will be installed, and then our construction will be finally complete. Does anybody have any questions for me?
Are you having a party?
Yeah.
We should.
Just a note in the animal world, Lyme's is skyrocketing.
I heard ticks are already out.
They've been out.
I don't understand. They should have got froze to death.
Nope,
Thank you for
our
that.
weather is not conducive to that right now. Okay,
Thank you.
all right, any other questions? All right, we'll move on to environmental health.
All right. Hello, everybody. Speaking of ticks, I'll roll right into that. So we have posted our EH technician position, which is usually a college student that we hire for the summer to do both our vector surveillance, which is trapping mosquitoes and ticks. So hearing that means we'll probably find a lot of ticks this year. And then also our beach monitoring. So, that position has been posted. If anybody knows a college student in the area looking for a job, even anybody out there, it is on the website. I've sent it out through, there's a website a lot of the colleges use. I posted it there this week. So fingers crossed, we'll get some good candidates rolling in here fairly soon. In addition to that, it is food service licensing renewal time. So those licenses have, for the most part, gone out. Those are due by the end of the month, so we'll start to see some of those. We've already had a couple that have been on top of it that have come in and renewed, so, that seems to be rolling smoothly as of right now. For your reports for the month, apps are still a little down, over where they were last year, but permits are up. And I will just say, just anecdotally, the last couple of weeks, I feel like applications have just been flying in. I think with the weather, with its ups and downs right now, but those warm days, it seems to be kind of spurring people. So I think overall, we're probably about where we typically are. And then of course you have your food report. It is school month, so, my sanitarians are out hitting all of the schools this month with food inspections. I think that is all I have, unless anybody has any questions for me.
All right, thank you.
All right, thank you.
All right, Monica, we'll move on to emergency preparedness.
Emergency preparedness has been busy lately. There's been a lot of training for Michigan volunteer registry that I've conducted and some other work plan mandatory staff assemblies and things like that. All of the AEDs have been ordered that we were approved through this through the FEP grant, and they have been ordered and received for all the county buildings, and they have been, I believe they're in the process of getting installed in conjunction with emergency management and maintenance. And besides that, I think we're good.
All right. We'll move on to finance then.
My report this month is actually quite short. It's the last day of our second quarter. We'll be getting those reports out. I'm starting my preliminary work for our next budget season. I know it starts really early. I feel like this just ended, but, it's a never ending cycle. And that's all I have. Any questions for me?
With the government shutdown or partial shutdown or whatever they want to call it these days, have you been getting your funding?
We've
Regularly?
not had any pauses or anything with any of the funding. We haven't been notified of anything being delayed.
Okay.
Everything so far has been business as usual.
Okay. Any other questions for finance? All right, we'll move on to public comment. All right, hearing none, I'll look for a motion to adjourn. Whoops, go ahead, Terry.
Just a request for the ladies. I have to report out to the commission after these meetings, and sometimes I don't get the notes ahead of time. So I take notes. I write at a relatively good speed. You people talk at warp speed.
Yeah.
In the future, we could just slow it down a little bit for an old geezer like me to catch up on the notes.
Maybe we should get you pre-printed reports from them. How's that?
Okay.
I have a question. I should have asked back when the minutes were first approved, but
Mhm.
I was reading over, people who receive education because they say they don't want to vaccinate their children, so then they get educated. Are there any, or do you have a percentage of who changes their mind about vaccinations after they get the education? Does it work?
Since I've been in the director position and I was 5 years in a supervisor position, I think we've maybe had a handful of parents that have changed their mind after receiving the education. On average, we have between 350 to 450 families that choose waiver education every year for one reason or another. I would think last year we had one family change their mind, and it was a delayed schedule, which we're all in support of. Whatever we can do to help a family, whether it's education or a waiver or to support them in a delayed schedule or whatever it is, that's what we're there for.
So they don't have to go through the education to get the waiver?
They do.
They do, I thought.
It is a
Okay.
public health code law that they
Okay.
have to receive the education.
But if they're doing it online, they might just turn it on and not even,
So
Anything.
the online port, so what the process used to be, just so you know, it used to be about a 45-minute to an hour in-person session. Now the state has contracted with U of M. They have produced an online education portal
Mhm.
that at the convenience of the family, it's a lot easier for them to do that at home. They go through the education, we get notification that education has been completed. They come in and sign the legal document, which literally takes 30 seconds, and now their education is complete compared to an hour in session
okay.
education.
Do you think you had better results when it was?
We
done
absolutely
online?
have had better results.
Yeah.
Both with staff and the parents, or guardians feeling it's less time that they have to take
Okay.
out of their day.
Right. Thank you.
You're welcome.
Minor little thing, Dr. Tripp. When we say A, we obviously all say A, and there's nobody that says an A, but technically you're supposed to ask who says an A.
All righty.
Sometimes we've had people sitting out here who make the
I will change my, referendum.
So will we address this issue with the sewage inspections at future meetings or?
I would assume we will.
Sure, I think we can take some time to look over the data and the impact and then, bring it to the board and see if there's a recommendation or if there's more questions or anything like that.
All right, any other comments? Hearing none, I'll look for a motion to adjourn. All right, we'll stand adjourned at 4:31.
Thank you.